Lawmakers introduce LGBTQ plus and women's history educational bill. Plus, trans woman now in men's prison after impregnating 2 other women during consensual sex. Also, NFL player Kyle Nassib reflects on a year after publicly revealing his sexual orientation. And monkeypox is not a gay virus, says CDC. I have a one-on-one interview with advocate editor John Casey on this important topic. That's coming up on this edition of Pride Today. Hi, I'm Stephen Walker. Democratic members of the House of Representatives introduced a bill to provide students with the resources to learn about LGBTQ+ and women's history. The new legislation will allow the director of the Smithsonian National Museum of American History to create and distribute educational materials that promote an intersectional and inclusive approach to teaching LGBTQ+ history and women's history in the classroom. Advocates for this bill praise its introduction while emphasizing its importance as a number of harmful anti-LGBTQ+ bills continue to become signed into law in numerous states. A New Jersey trans woman is transferred to a men's prison after impregnating 2 women in the state's only women's correctional facility. All of this surrounds 27-year-old Demi Minor, who's been transferred to the vulnerable inmates unit as she's believed to be responsible for getting 2 women pregnant while having consensual relationships with them both. The Garden State agreed to house most trans prisoners according to their gender identity while providing gender-affirming care after a trans woman sued the state in June of 2021. That time has passed, however, the New Jersey Department of Corrections continues to operate under that policy. Demi is now at the Garden State Youth Correctional Facility to serve out a 30-year sentence for manslaughter. NFL player Kyle Nassib opens up about the decision to publicly come out last summer via a minute-long Instagram post that has changed his life. After creating the social post, Nassib said it took him a while before pressing send, and that he was thinking it would be inspirational for other kids to see and hear his story. Nassib's decision came after 15 years of struggling and navigating his authentic sexuality. He recently donated $100,000 to the Trevor Project, a non-profit organization that focuses on crisis prevention for LGBTQ+ youth. The NFL player also says he hopes there will eventually be no need for a coming out process. The Centers for Disease Control and Prevention clears up misconceptions about the monkeypox virus and warns it is likely to spread. For more on this, here's my one-on-one interview with advocate editor John Casey to discuss the nuances around MPV. Hello, I've got John Casey with me and I'm going to chat with him about his interview with Dr. Fauci. Hi, John.
Hi, Stephen.
So, John, apparently Dr. Fauci told us that Denmark has a number of vaccines sitting there. How do we get them to the places that are needed most? And what can we do to get them to the LGBTQ community?
Great, good question. Thank you. Yes, Dr. Fauci, they're hard at work getting those vaccines here. So as of last week, Denmark had sent 150,000 doses. Then on Monday of this week, they sent 130,000 additional vaccines. And then Dr. Fauci said by the end of July or sooner, we should have about 740,000 more doses of the vaccine delivered here to the United States. So that means by the end of the month, there should be 1 million vaccines here from Denmark. So we're trying to play catch up. So this will be a big part of doing that.
People are saying this is mirroring, the AIDS crisis and more recently, COVID. Why haven't we learned from those lessons and getting out early response, or are we doing it?
So Dr. Fauci explains that HIV, AIDS, COVID, and monkeypox are sort of 3 different senios. So, in the early days of AIDS and HIV, between 1981 and 1984, they didn't know what the infecting agent was. There also was no treatment options, and there was no vaccine. So it wasn't until 1987 when the first treatment option became available, which was AZT, and then not until 1996 to the triple cocktail became available as a treatment. So in COVID, at the moment, we have treatment options. We know the infecting agent. We have treatment options, and we have vaccines. The issue with that is it's being implemented, but part of the American public is not getting the vaccine. So in other words, we have about 67% of the American population which has got a vaccine. 50% of those have only got one vaccine. And the goal for public health is to get 95%. So while all the tools are there, it's been the reluctance of some Americans not to get the vaccine. Now, here we are with monkeypox. So they know what the infecting agent is. There is a treatment and there is a vaccine. The problem has been with this is the implementation. So they're racing to correct that and making sure that the treatment options as well as the vaccines are ramped up, and they're working night and day to be able to do that.
And we've just been told that the two vaccines, there's a two vaccine system, but the first one is effective. So surely we could administrate that and then we're good. Buy us some time, because it's up to 2 years now apparently you can take the second vaccine. So is that what we're going to do now?
Okay, so that is sort of a misnomer. I think that came from New York City Mayor Eric Adams.
Yes.
Who said that. So Dr. Fauci said that's entirely not true. The first part is that while the vaccines are available, we should be delivering one. The recommendation is that within a couple months, you get the second vaccine. You need to in order to effectively be resistant to the virus. So the way things are moving and progressing now, Dr. Fauci feels it's fine to give those people who are coming in their first dose. And within a couple months, which is how long the first dose lasts and you need the second dose, that there'll be enough doses to be able to provide everybody with the second dose. He did say that 2 years is pretty much too long, that the second dose needs to be delivered within 2 to 3 months. And I would imagine, and we talked about the COVID stuff, the same thing with COVID. You know, you needed your shot and then you needed your booster shot. It's similar to this. So it does provide you somewhat of a defense mechanism with the first shot. But in order to get the full effect, you do need 2 shots within 2 to 3 months.
Okay, and then obviously discrimination is out there. What did Dr. Fauci say about that discrimination, particularly within our community?
Yeah, stigma is the biggest enemy of public health, according to Dr. Fauci. And so it's a fine line. So for public health, because that monkeypox has affected the gay community first, whereas it hasn't affected, women or men or other different communities, it's affected the gay community first, and the gay community is pretty much on the front lines of being infected. So public health officials, they do have to provide some warning and some regulations on what you should be doing to help prevent you from getting sick. So they do have to call out the gay community, do have to provide those warnings, but they have to do it in a way that doesn't stigmatize the disease. So Dr. Fauci has been pretty clear in saying, yes, the gay community is being affected now, but this disease will spread to other communities, other locales, other locations, other states. It's not going to be restricted just to the gay community.
And also, I heard that he corrected his statement. He's not actually going to retire at the end of Biden's term. He's going to stay on within the medical field. Is that correct?
Yes. So the question to him was, if Donald Trump was reelected or a Republican was reelected or Biden was reelected to a second term, would he continue in his role at the NIH? And he said no, that he would retire from the federal government, but that he would continue working on the causes and the diseases and the research that he's worked on for the last 40 years. namely HIV and AIDS. So he wanted to make it very clear that he's not leaving the fight, that he's just going to take it somewhere else and continue the work. Because when I talked to him in the spring, he said that, he wants to stay in the fight until there is a cure for HIV/AIDS. And so that when the rumor went out, I guess, or the misnomer went out that he was retiring, that wasn't true. He was just leaving the federal government, but he will continue in the fight. And so I think we're all willing to hear that.
Thank you, John, for taking the time out of your day to talk to us today. I appreciate it, and I feel a lot more informed now. I appreciate that. Thank you.
Thank you, Stephen, and please, everyone, stay safe out there.
For more on these stories, visit advocate.com.